tell you. Okay, so here we have a 5-month pregnant lady, and she's going to show you what's causing her pain currently right now. Go ahead. Right there. Right there. Okay, and what about when you go to the other side? All right, and so when she's going to pick up her toddler right now, is it when she's got problems? And so we're going to just take her through and see what happens. All right, now we've gone through the 4 tests, and so she's done the twist and the sit to stand, and or sit. She's done all. She's just done 4: the arm raise, twist, leg raise, and sit to stand. The worst one was the twist, and so here's how she did her twist. All right, well, here's how she did her twist. Go ahead and do one twist for us.
Like treat side?
Yeah, treat it.
Okay.
And again, we've already, sorry for sake of doing it, so I'm going to show you what she's wanting to do. Oftentimes with a pregnant lady, if they only do their twist into the quote normal looking way, they actually get locked up. But I've showed her, keep moving the chair as you need to. And she goes, you know, this really feels good. And I said, well, let's just keep going into it. So basically what she's doing, she's twisting, and she's allowing her whole body to get into the twist. And sorry, there's some echoing and some noise going on here that you're going to notice. And she gets into this one position here, and she's going to eventually say, because we've done a couple of these, so what you saw in the beginning was she was actually better than when she walked, because when she first came, she was like, ah, like that. So she's actually better. She's going to get this in the position she likes. And before she was continually to twist, but she gets into a point that she goes, that's like really good. There's no stretch. It's just a nice sensation.
Yeah, I feel like I could sit for hours on the floor with my baby this way.
There you go. If you didn't hear, she said she feels like she could sit for hours on the floor this way. Some people at this stage may say, oh, you know, I'm really cautious about pregnant ladies and stuff, but this is what it'll get to. You'll get to a point that they say, this is it. This is like my great spot right there. And she takes a deep breath, which means she's gotten a release, and it's a release in her ribs and everything. And if you've been around enough pregnant ladies, oftentimes they think having their legs brought to their chest makes them very claustrophobic and very anxious, but yet she's in this position feeling very, very comfortable, and it feels very kind of open even though you're closed down. Yes? Mm-hmm. Yeah, which is just kind of odd, but that's what's kind of cool about this. And then, you know, so I've talked long enough, she's been there long enough, but again, she could stay there if she wanted to. Now she's going to come on out of it. Again, you guys know from now that I'm testing her twist, but seeing you didn't see it, don't worry about that. We'll just go ahead and test her issue, which is go ahead and check it out. And so you just see her speed, everything comes up quickly. I wanted to show you one more thing that we had found. Oop, a little cautious. Oh, there she was. And she said she was initially cautious, thinking it was going to hurt, but it doesn't now. And so the other part was, again, the other thing we found was leg raise was a problem. And so go ahead and show them how we decided to do leg raise. Oftentimes with, that's fine. Pregnant ladies is that holding it up there is just way too long. And so go ahead and test them both. All right, and so what she did was she found the left side's easier, and she's going to not do holds, but she's just going to do reps. Now, if that's a problem, put your hands on your belly. If that's a problem, they could do bent knees. All right, but they have to test it doing bent knees also. And again, this is a wonderful. I mean, she came in. How long have you been having that? Just feeling really nasty in your back?
5 days.
So she's had 5 days of, I mean, she really was nasty. She just couldn't bend over. She couldn't pick up her kid, and very problematic. And we're actually going to test her in a bit to see whether she can now pick up a weight that's relatively okay. So again, just stand up and retest your bending over.
Okay.
See the speed of that. And that's what I like. There's no even caution on that part of it. All right, which is nice. Now, I'm going to put a lighter weight down here and just see. Now, is she ready for it and stuff? Well, she'll find out. But if we don't do this, she'll be very cautious when she goes to pick up her baby. And that's not what we want. We don't want her to leave here feeling cautious.
How much weight is this?
About 9 pounds or 12 pounds. Good?
Yeah.
And back down. And now once you come over on this side and try it too. And so she's got about a 20-pound baby child. So we put about 12 pounds on her. How'd it feel?
It's okay.
All right. So she's a little cut. She, she's got a little. It's okay. Again, she's not going to be picking that low down typically because,
right.
but something there. But you've got an idea of what to do now. Now the one part is we haven't done sit to stands for you yet. Okay, which is oftentimes the one that people may hate, but this can go from any height that we need it to, and so she can now do sit to stands, test the good and the bad. And so she's even kind of being bothered by that, but find the good and the bad, and I don't want it to be difficult, so you tell me.
So my left side is much easier. Go ahead and start.
Let me see your left side.
Okay.
Okay, and so go ahead and do that one. And so I put another chair next to her because if that's tough, and again, she's pregnant, she may fatigue out quickly, so I put another set of chairs by her because if she wants to finish up there. And this is what I tell you, is that it's not about struggling to get it done, okay? It's about it should be smooth and you look forward to the next set. If you don't, go over there. All right, did you notice what I said there? I said, I want her to look okay forward. What does that mean? It's kind of like my idea that, hey, this is at a height that, yeah, I don't mind doing that. In fact, if people are getting fatigued, if you put them at a nice higher height and make them do it, they'll say, ooh, that fatigue in my leg is now gone, which is kind of nice. And you're going to rest and you're going to do another set.
Okay.
And then she can go back and treat or test that right side again when she gets done. But you rest as needed. TMR works great with pregnant ladies. I wish I could have my own little niche and convince the doctors that pregnant ladies' pain can actually be changed. The idea of massage can be a nice thing and all, but again, it's a feel-good kind of thing while they're there. Maybe they'll get some relief a little bit before. She actually had a massage and actually brought this on, so she wasn't having pain until she went to have a pregnancy massage. Not to say that's the typical thing that occurs. But it doesn't give them anything to do for themselves. Now, I'm making her do 3 things just because we're on camera, but I would have probably sent her home with maybe just the twist if we found it to be great. We'd already done the leg raise, which just did really well too. So I would have probably sent her home with the twist and leg raise. She wouldn't have had to do this. She wouldn't have had to do them all at the same time during the session. She could have just picked one time during the day to do one. Retest over here though, because that's where you tested from.
Still having trouble picking my foot up.
The left one?
Well, like getting it off to support this one. Letting this be all the way. It's like I get stuck.
Okay, let's go over here and let's go ahead and bend over without the weight right this second.
Okay.
It's good. So she doesn't have any pause or anything. Go to the left. And why don't you go ahead and now move up and pick up the weight. Nice. And actually, you guys should know by now that you're looking for speed. Go ahead and put it down. And then she's going to, she put it on that side, which is fine. No, that's fine. Notice that she doesn't have a cautiousness. So we'll try one more time, have her do a sit to stand. Again, we already have 2 winners for her, leg raise and twist. And this, she may say, I'm hating it. But now look, you can do it from the edge of the chair if you'd like.
This edge?
Yeah.
I can't do that.
You can. No, but it could be a sofa cushion. That may just be too little. I mean, too easy.
Can I stand back?
No, not that.
Not that time. So go back to working my leg, not test.
Your good side.
Okay.
And she can go to the back of a sofa cushion, or sofa, I mean, if you want. Do you want to go over there?
Yeah.
All right. And so I have
The other ones when I was doing them.
Not sure. Go ahead and, Lindley, why don't you face right there on the end of that sofa.
Where? Right?
Yeah.
Right here?
Yeah.
Oh, okay.
So again, she's got the back of a sofa that she's doing. This is my little studio where I actually have it set up with lights. And but it's also got a little like TV area and stuff. Is that height decent?
Yeah.
But you were gonna ask me a question. What was?
I was gonna say the other two felt better doing them.
Okay, and so what she just said, and she's been in tune, she's done this stuff prior to being pregnant. She said the other two just felt better on my body. Well, she's done this well enough, or long enough and with me throughout the years that she kind of gets that idea. But just for the sake of it,
Okay.
how many set, have you finished up one set?
One set, yeah.
Okay. Which would tune into it more because, I'm going to listen aspect-wise on her. And then sometimes they may say it, but they don't know yet whether it's good or bad. They have nothing. They just assume it's a bad thing. So with that case, I wouldn't listen to them until it was proven to be not as effective or something. All right. So now we're going to come back over here. Let's retest at our height. Ooh, you got a nice little white. Okay. Now go ahead and retest.
Oh, whoops, I forgot what I was doing. Okay. I still have trouble not.
Still hard.
Yeah.
Still not putting it like that. Okay.
It's better
Good.
than it was, but.
And then just stand there and let's go ahead and make like you're going to pick something up.
Okay.
Want to make sure we're not making her worse or something like that.
Doesn't feel as quite as easy.
Oh, see that? So now what she was saying, she says, this doesn't feel like something I want to do, which is now, if that's the case and proves to be the point, she should say, yeah, it just doesn't feel as good. So now go ahead and do the left side.
My back feels like it's starting to catch again.
Okay, and so something about that sit to stand. Now,
That says
now,
okay, but this.
okay, and so she said that, and so what would you do? You'd go back down to that which was okay with her, and so why don't you sit there and
Okay.
do your leg raise?
Okay.
All right, yeah. And so a nice little training part is, look, she got better. The deal is if she got worse, just slightly, and arms on your belly. And you might just say, ooh, she should go back and test those legs, but,
whoops.
No, it's fine. Let's just assume that she was correct in the right one. But she's going back to get herself back to normal. Rule number 3 says if things get worse, tweak it. Now, we tweaked it just by making the height higher to see if that made her kind of better. And it didn't. Her speed slowed down. And the next thing is go to another exercise. And so we're now going back to one that was effective. Well, I'm not going to skip to something else. And she doesn't like this one as much. She loves the twist. Okay, I'm making her do this one somewhat more because it's active, but it doesn't mean I'm right. All right? It's really about what's giving really nice results. I choose this one because when she gets up and goes to bend, she doesn't pause at all usually after she's done the leg raise. She does a little bit more after she's done the twist. So sometimes you as a therapist have to be able to look at it and go, what is she looking like now that she wasn't when she's testing herself?
Okay. I'm going to do it without the weight.
Yeah, correct. That's fine. And see that? There's no pause to it. And it's very quick. There's not like she's trying to throw her back or kick her back. All right, and now why don't you try the weight?
Okay.
Good. And now the other side. Feel okay?
Yeah.
Little pause there. I mean, not as good as it did.
Yeah, not as before. It's good, but
And you
that's okay.
might fatigue. Well, why don't you go do one set of your twists
Okay.
that you like. See, she instantly goes, okay. So the body, I mean, when you've done this stuff enough and somebody knows, is that the body knows which one it wants to do too. And again, this is the first we've seen her at all since she's been pregnant. So, all the rest of her intuition as far as these things go has to do with what she was doing before. And I will tell you, when people know what it is they like, and if you listen to them, you'll get really good results there. You can, get off, move the chair around. And again, this chair was just good height for her. Her knee comes down, she's doing this. And somebody may say right now, oh, are we supposed to do this? Or are we supposed to do that? Or is this it? But notice she's allowing her leg to move and stuff with her. She's not allowing anything to get stuck. Sometimes I'll actually put a book under their knee so they feel like they can flow. Go ahead and pick up this knee for a second.
Okay.
Boom. And it doesn't matter that they stop for a second, but that can make them feel like they've got more motion. And she's just going to go. What's that?
It does flow more easily.
There, so she just said, hey, that book did help. And, you know, she could put the book there on her own. She doesn't have to have it. I could give her, instead of that chair, because it doesn't have wheels, I could give her, here you go, ding, 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 ding. I give her a roller stool that she may say, well, no, I like the stability of the other one. Who knows? And she's trying to now assume that position that she likes so much, and it may look somewhat different than it did before. And she's sinking into it. Yeah. And then she goes, yes. Are you there yet?
Uh-huh.
Yeah, and then she says, and she knows she's there. And she says that feels comfortable. She's wrapped up like a pretzel. Now, you guys out there that have really tight hips, it's amazing when you do a twist like that, how much you can even wrap yourself up into a pretzel. So now, some of you may say, should she continue to twist? And the deal is, you test that. She said she just feels like this is a really nice position. And so it's not active, but she can just hang out there for a while. How long of a while? Until she says, okay, that just seems like I'm getting tight now again. Or your legs start falling asleep, like she just said. Or we can say, okay, well, let's test that one. And then we could actually do another one with her twisting and seeing what happens, but not all together, okay? You always want to be able to test. And then we're going to have her get up, have her test again.
Can I do one without the weight, or you want me to go
straight? Yeah, no, always start without the weight. Good. See. Ooh. So again, a nice 5 days worth of, my lights are going funky, of pain, and and I agree with her now. Look at the speed in which she's doing it. Look at the certainty in which she's lifting that weight with now. And I feel more confident. And she feels more confident with it. Good. Cool.
They feel good.
I hope that helped you guys out, because this is a got the poltergeist or something going on here. So enjoy, y'all. I hope that gives you some more security and confidence in treating pregnant ladies.